This is the Hunger Games on Medicaid have begun. Medicaid, of course, is the program for low-income people, working-class people. In most states, certainly in red states, you can only get on Medicaid if you make under $2,000 or $3,000 a year. It varies from state to state. Some states is as high as $5,000 a year. In blue states, pretty much anybody can get on Medicaid if their income is low enough. But in red states, it's very, very limited. But in 2020, in March of 2020, when the pandemic was just whacking America, Congress passed legislation allowing pretty much anybody to sign up for Medicaid. Now, in blue states all across the country, pretty much anybody already had signed up for Medicaid because the Medicaid expansion that was built into Obamacare, which goes back to 2010, if my memory serves me right, that Medicaid expansion was embraced by all of the blue states. It was opposed, however, by red states that hated the idea of their poor, low-income, working people, particularly people of color, getting health care. They're still subscribing to Frederick Hoffman's theory that if you deny black people and Hispanic people health care, they will eventually die out. I mean, they're literally still promoting that meme. So anyhow, in 2020, at the height of in March, this is the month we shut down the government, shut down everything, not the government, but the country. That March, we passed this law saying, anybody can be eligible for Medicare, or Medicaid, excuse me. And millions of people signed up in the red states who had not been eligible before. Well, that expired last month. And now the red states are doing this Hunger Games thing where they're just throwing people off left and right, and people are begging to get back on. This is from Kaiser Health News, KFFhealthnews.org is the website. It's what used to be called the Kaiser Health Foundation. They now call it KFF. More than 24 people lined up outside a state public assistance office in Montana before it opened to ensure they didn't get cut off from Medicaid. Callers in Missouri and Florida, these are all red states, by the way. Callers in Missouri and Florida reported waiting on hold for more than 2 hours on hotlines to renew their Medicaid coverage. The parents of a disabled man in Tennessee who had been on Medicaid for 3 decades fought with the state this summer to keep him enrolled as he lay dying from pneumonia in a hospital. States who have reviewed the eligibility of more than 28 million people and terminated coverage for over 10 million. Now, this is almost exclusively in red states. Some of this is happening in blue states, but for example, California, in the people who are no longer eligible for Medicaid under these rules, they're actually, when they call these people up and tell them you're no longer eligible for Medicaid, they're then working with them to get onto Obamacare or some other program. But, there's state programs as well. But in the red states, it's just, hey, screw you, good luck, see you later, off you go. Don't let the door hit you on the way out, and don't come to crying to us when it's time for the burial, right? We're not going to pay for that either. Camille Richaud, the health policy director for the Arkansas Advocates for Children and Families, says this is not just bad, it's worse than people can imagine. This unwinding has not been about determining who is eligible by all possible means, but about figuring out how we can kick people off by all possible means. This is just so wrong. Doctors, again, I'm reading from the Kaiser Family Foundation. Doctors and representatives of health community centers around the country said that they've seen an uptick in cancellations and no-shows among patients without coverage, including children. Nationwide, states have already disenrolled at least 1.8 million children in the 20 states that provide that data by age. California, by contrast, started terminating recipients only this summer and is automatically transferring coverage from Medicaid to marketplace plans for those eligible. The Medicaid disenrollment rates of people reviewed so far vary dramatically by state, largely along a red-blue political divide, from a low of 10% in Illinois to a high of 65% in Texas. Paula Campbell of the Illinois Primary Health Care Association said, I feel like Illinois is doing everything in their power to ensure that as few people as possible lose their coverage. The worst phone rates, it turns out, were in Missouri. We just had a caller from Missouri talking about this. Some people are waiting on hold for more than 3 hours, and that's a significant hurdle or burden for low-income populations who typically have phones that have plans that charge by the minute. Sitting on hold for 3 hours? It'll wipe you out, right? Wipe out your minutes. In Florida, which has removed over 730,000 people from the program since April, enrollees earlier this year were waiting almost 2.5 hours to have somebody answer the phone for them. They go on to note, again, Kaiser Family Foundation, some Medicaid recipients are seeking help through the courts in a 2020 class action lawsuit against Tennessee that seeks to pause the Medicaid eligibility review. Parents of recipients describe spending hours on the phone or online with the state Medicaid program trying to ensure their children's insurance coverage is not lost. Well, you know, that's the problem. When you're looking at states like Mississippi or Tennessee or Alabama, you're looking at these red states, Florida, Texas, they're, you know, the word that's coming down, the pressure that's coming down from you know, DeSantis's office and Abbott's office and Tate Reeves's office and on it goes. The word that's coming down from them is get rid of as many people on Medicaid as possible, which is bizarre. The federal government pays 90% of this cost, 90% of it. But these states, they do not want their low-income workers to have health care. Or at least the Republicans in these states don't want their low-income workers to have health care. Why? I think it's because they're trying to kill them off. And by the way, they're succeeding. As I pointed out in the first hour, over 1 million people a year in America are dying absolutely unnecessarily just because of Republican policies, largely in red states. And now MAGA Mike wants to inflict that on the entire United States.